Lovely. Ah! Hi everyone. Today we have a patient who has multiple issues, but currently we are focusing only on one, and that is a low back. আপনার কোমরে ব্যথা কতদিন ধরে হচ্ছে?
It began in 2021 May.
When you came to for me for consultation, 10 এ কত ব্যথা ছিল?
Oh, I'm way past 10. I was 100.
Let's check how our low back is through the MRI. Come. আমরা যে MRI-টা ওনার দেখছি, which is the lateral part, and you can easily see over here that ওনার এই যে হাড়টা L5 আছে, এটা সামনের দিকে স্লাইড করে গেছে বা স্লিপ করে গেছে. So this is called anterolisthesis of L5 over S1, সামনের দিকে যেহেতু ঝুঁকে গেছে, and that's why ওনার sciatica দেখা দিচ্ছে, and we are going to treat this sciatica, and obviously the L5S1 junction we would like to reset it as much as possible and see if we can reduce her sign and symptoms. So keep watching. Change of hand position. Couple more times. Done. You are now going to hold on to your elbows.
Okay.
Elbows and look up. 3, 2, 1. Down. Bam. Done. Come. Right leg short. Lovely. Now take a look. Bam, 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 bam. Resetting SI joint, left SI to be specific. Lovely. And wonderful. We are activating the G-max. That's what we are trying to do. First the left and then we'll go to the right. Up and down. Perfect. Thank you. Thank you. Keep going. Keep going. Done. So Dr. Chakraborty is going to do an AP thrust of the thoracic spine because onar ekta thoracic kyphosis ache, and we should try to eliminate that so that the force that goes down and up the chain, that is your spine, is coming to one point rather than getting distracted all over the place. So let's see how it's done. সোজা হয়ে শুবেন, দুটো হাঁটু ভাঁজ. Sweet! Look at the amount of cracks you are getting. Jeez! Head up, head up, head up. Lovely. Champion. So right now Dr. Mollik is going to do a certain technique to help release the D12L1 specifically, because onar kujota ache, kujo bhabta is like a S curve, and we want to reduce that S curve, and that is called the pivot point, and the area of hypomobility. We'll try to eliminate that issue. Hold the fingers tightly, but keep your hands and everything loose. Loose. Sweet. Don't move back. Lovely. Leave your back on his chest. She is taller now after all these decompressions, isn't it? 3, 2, 1. Moment of silence and moment of truth. It's like meditation. যাদেরই anterolisthesis আছে, bending backwards is a big time no. Never bend backwards, okay? আর যাদের পোস্টেরো বা retrolisthesis আছে, তাদের আগে ঝোঁকা মানা, ঠিক আছে? So please give this a thought and stick it in your head. All right? So tell us how you are feeling.
Oh, great, superb.
All right. So any pain as of now?
Pain, yeah, slightly. That sensation
Okay.
is down that side.
This is what I want. So let's say it was 10 on 10. So how much is it right now?
3.
Okay. Where is it that you are feeling this?
Exactly this portion.
God. Okay. এক দিনে you saw it's probably more than 70% of her sign and symptoms is gone. She has a little bit of hamstring tightness. We can easily reduce that with a customized exercise program, and then she'll be back with us to probably feed us with mishti.
Absolutely.
All right, thank you so much. Until next time, bye. Bye.